I'm so glad the kids weren't in the car that day. I remember the impact, the noises, the smell, and I woke up with all the people running up to my car. It was smoking and the horn was screaming. They airlifted me to Auckland Hospital. I had facial fractures, skull fractures. My right arm was smashed. Broken ribs had pierced my lungs. My liver was shredded. If not for the expertise of all the trauma services, then I wouldn't have stood a chance. The kids are all so grateful to the doctors and nurses. Caleb, my 10-year-old, he's just like, they gave me my mum back. Words can't express how grateful you are at the end of the day, that you can come home to your kids.
Every day, the Auckland District Health Board provides crucial healthcare to New Zealanders, giving care, comfort and hope to those in need. It supports the well-being of 347,000 patients across the country with its leading range of services and specialist healthcare. Home to the largest medical training facility in New Zealand, it's committed to the future of the country's healthcare and works towards a vision: healthy communities, world-class healthcare, achieved together.
The Auckland Health Foundation is an independent charity created to help achieve this vision. Our goal is to ensure the future of healthcare in Auckland is world-class, to provide greater health outcomes not only for Aucklanders, but for the whole of New Zealand. Through donations from grateful patients and the public, we support projects, research and education for adult health services at Auckland DHB. Together we can transform the way healthcare is delivered.
With your help, we can go beyond what is presently funded to focus on advancements that give the best possible outcomes for patients and communities. Success isn't just the technology, research and facilities our supporters have funded, but the lives they have enriched and saved in doing so.
The work they do at Auckland Hospital is amazing. I pretty much owe them my life. The professionals said that without that clot retrieval procedure, I would have had a 1 in 4 chance of ever being independent again. So probably wheelchair bound, which is crazy to think about actually. It was the last thing I expected, the timing of it and everything. Woke up and went to get out of bed, basically collapsed forward onto the ground in front of me. And then the next thing I remember is waking up in hospital. I had specialists come in. They explained to me that I'd had a stroke and everything that had been done. The fact that I was airlifted up to Auckland and was able to have this special clot retrieval procedure done relatively quickly was a lifesaver. I can't thank everybody enough. Been given a new lease on life.
We know hospitals can be scary, especially when you're not feeling well. From small accidents to life's greatest challenges, you rely on care from compassionate caregivers. Everyone within the Auckland District Health Board is committed to providing you with comfort and the best medical expertise.
We want to give our patients the very best health outcomes. With your support, the Auckland Health Foundation can help make this possible. To support staff training and education, we'll develop a state-of-the-art, world-class simulation centre that allows staff to learn new skills, refine their techniques and build confidence together. A well-practiced team can make all the difference in saving lives. We'll advance discovery through patient-focused research that can transform healthcare and lead to breakthroughs such as the world-first PrEP2 algorithm, a technology used with stroke patients to help ensure their recovery potential is realised. We'll transform patient care by supporting new processes, innovation and equipment that changes lives. Lung transplant recipient Paul was given a second chance at life thanks in part to ECMO, a form of life support that acts as the heart and lungs while patients receive treatment.
We're so lucky we have the ECMO here, or all of this would have been impossible. It's been a roller coaster, but I feel so lucky. I've had asthma all my life. I was in and out of hospital as a child, and I had to stay indoors while other kids played outside. Over the years, I've managed my asthma, but last year I fell seriously ill with a chronic condition and was put forward as a lung transplant candidate. I never had an operation before. It was a nerve-wracking time, but it was fantastic and everyone made us feel good that day. I've been in hospital recovering for 14 weeks, but today is a very special day. I can finally go home. I can't put into words how grateful I am. Thank you doesn't feel like enough.
To ensure the best quality healthcare for everyone, the Auckland Health Foundation is going beyond what is funded in the healthcare system, and your support could make the difference. If you can make a donation, that's wonderful, but maybe some fundraising, maybe you can volunteer, share your story, or even tell family and friends. Whatever you can do, get on your computery thing, go to aucklandhealthfoundation.org.nz and make a difference. Together we can ensure world-class health outcomes, not just for Aucklanders, but for the whole of New Zealand. And more importantly, me. Ngā mihi.